indocyanine green, or ICG, is a water-soluble dye that was developed for use in infrared photography by the Kodak company. It found its first clinical use in liver function tests and cardiac output measurements, and subsequently became popular for use in retinal angiography. Rubin first described the use of this technique for assessing the perfusion of random flaps in rats, and this was subsequently followed by Still, who showed a similar application in humans. Since then, the role of indocyanine green imaging has expanded and continues to do so. In order to appreciate the promise of this imaging modality, it's important to understand some of the pharmacokinetics that is associated with this. This molecule is completely protein-bound and once administered remains confined to the vascular or lymphatic channels without interstitial leakage, thereby allowing clear visualization of the lymphatic or vascular tree. It has a short half-life of 3 to 5 minutes only and is rapidly taken up by the liver and excreted in the bile without further metabolism. Since there is no renal excretion, it can be safely administered in patients with renal impairment, and here it scores over the common or more popular CT angio and the MR angio, where the contrast, the nephrotoxic potential of contrast is a consideration. The basic principle of ICG imaging revolves around the fluorescent properties of this molecule. Indocyanine green shows a maximum selective absorption capacity in the near infrared of the light spectrum. And then this is then reflected or emitted as a fluorescent signal.